share screen. Yes, thank you very much. Now Asim is ready. Good morning, Asim. You look great. Your mic is yours, please.
Good morning, Jihad. Good morning, virtual participants. Good morning, many friends from rainy Zagreb. And the big question, philosophical question for all of us is what normal people should do in abnormal time. We all are living in abnormal time and everything is different. Unfortunately, very probably everything will stay different. One of the solutions, at least for me, is to go to write, to study, and to publish and to present. So my favorite topic about fetal brain activities is best to start with this graph. This graph, which you all should remember, said that in spite of the 6 times influence increased incidence of cerebral palsy, most frequent chronic motoric disability in childhood, we do not have any improvements in the rate of cerebral palsy. So cesarean section doesn't help to solve this problem. So what really we should do, and is there any optimistic idea on horizon? Within 50 minutes, which is Jihad too short, I have to say that 16% of all scientific production in the world goes to brain research, and about 1,800,000 scientific papers by Scopus data have been published on this, showing that amazing power of your brain, and power of brain is one of the topics I'm studying now. That powerful organ can perform 10 quadrillion operations per second without you knowing it. No one computer can do that. So how we could now start to study 2 functions, sensory and motor, cognitive and motoric function. If you see these poor babies, this is lifelong disease. They cannot move without help of third person or equipment, and they will stay without any chance to improve or rehabilitate their terrible handicap position. So this is a boy at the age of 4 years. We detected antenatally with our Canet test and followed up and still following up, very poor quality of life. And again, very high incidence, no improvements in perinatal care help. So Olsen recently accounts that 35% of overall cost of the European Union dedicated to healthcare goes to brain diseases. Very new hot topic to be studied is cognitive function, ability to learn, memorize, think, perceive different sensation, have emotion is now a hot topic, and my team in Zagreb is deeply involved in this. We are also studying fetal awareness. Is fetus aware of its existence, and in particular in multiple pregnancy? Is fetal awareness new hot topic to be studied, or is it scientific fiction? We will see. There are data in literature that even intelligence starts in utero, and that another group of scientists studying cognitive function, starting our co-worker, Professor Aida Saljagic, physiologist, is deeply involved in this. Cerebral palsy is obviously obstetrician's new responsibility. And the question was, is fetal neurological assessment possible? Because 80% of cerebral palsy origin prenatally, 10% intrapartally. So we do have, recimo da odgaljimo za 12. We do have 90% of the causes in utero. And we started our interest during sabbatical in Barcelona 10 years ago, studying multiple pregnancy, paper published and everything is written there. Once more, incidence 1 to 4 per 1,000 live borns did not change since 1952. So 90% of the causes in utero, incidence didn't change since 1952. Who should solve the problem, try to solve the problem? you and me, when tomorrow, it's already too late. The more pregnancy in uterus, the higher incidence of cerebral palsy. We have learned that vanishing twin or triplets are causing 3 times higher incidence of cerebral palsy in reminded fetus or 2 fetuses. New hope is behavioral assessment, face-to-face, famous kissing twins. We do have unusual and repeated compression of umbilical cord, might be a reason. And this is grasping umbilical cord. Unfortunately, moving doesn't work, but you can see that this baby for 10 times in half an hour was strongly grasping its umbilical cord. We have 6 such cases, 3 of them died in utero. How to study it? It is said that fetal behavior directly reflects structural and functional development. So by studying of fetal behavior, which is one of the definition, fetal activities observed or recorded with ultrasonographic equipment, we can differentiate spontaneous and stimulated behavioral activities. If you, ladies and gentlemen, believe that this is very academic and Asim Kurjak exaggerate, his team is too enthusiastic, you are totally wrong. Look data from 2016 from very objective computers saying that PubMed database, that number of paper on fetal behavior studied by ultrasound increased tremendously. And this continues, this is very hot topic. And in my country, the most quoted papers in Croatian clinical medicine are papers from neurobehavior. Face was largely neglected. Face, thanks to 4D, is now source of many diagnostic information because face is predictor of the brain. We have here editorial in American Journal, the best journal in our field, studying fetal face, and our group as early as 2006 published normal standards for fetal neurobehavior in truly international team in our official journal, Journal of Perinatal Medicine. 11 weeks, movements, and 13 weeks, different movements. So as early as in the first trimester, we can recognize difference in the movements. And then new scoring system have been published and just several examples. Head retroflexion is one, decreased as the pregnancy advanced. Movement of the hand to head, easily done with 3D, 4D. Hand to eye, hand to mount, just to differentiate. There is no reproducibility need, reproducibility study. You simply push 3D and this baby will start to move. Very important for any one of you entering the field is to visualize hand and all 5 fingers and separate the thumb, because thumb in cerebral palsy is covered by the fingers because of lack of musculoelastic activities in the thumb. We call it neurological thumb, was present in all of our 11 cases detected prenatally. Does this baby like to communicate? Is this baby at the 29-week gestation aware of its existence? How about intrauterine psychology? Many questions, hardly any answer, but answer is coming only to research. So eyelids blinding, most frequent in the middle of pregnancy, and the yawning, even adult pathophysiologists do not know why yawning exists. Whatever the pathophysiology is behind that, yawning is normal parameter. And this naughty boy from Zagreb with the tongue expulsion has coiling umbilical cord on the neck. But is it cause or consequence? We don't know. However, this is normal parameter. There are many reasons to be angry in utero because science knows up to 150 diseases affecting fetus. So to visualize grimacing is not the problem at all, but to understand it, is it result of emotional process, feeling the pain, or whatever is still open question for many studies. Swallowing, again, very important parameter. So coming back to the cognitive function, big question is expression of fetal face reflecting situation in his brain? Because brain face is mirror of the brain. They have the same origin. You can see quite different behavior, and the face is source of information. We can easily take smiling and crying in utero. However, much more understanding we will need to show connection with brainstem and it does origin, to show is it reflex or is it really emotional reaction, we will see in the time. This is neurological thumb, covered overlapping fingers and covered clenched hand and thumb, proved after abortion. You can see that this is most important parameter for diagnosis of cerebral palsy. I will not go in statistics, but there is continuity from fetal to neonatal behavior because tongue expulsion, fetus showed by 4D, gray massing, you see this photo is absolutely the same. An antenatal photo can one day be passport photo, entering Turkey without visa. Smiling again happened in fetus and in neonates, and mounting and yawning. So, ladies and gentlemen, normal finger position always visualize. If you see 5 fingers, if you see independent movement between 2 fingers, you can be very sure that that baby is neurologically normal. Also look for normal cranial sutures and assessment of fetal behavior with new scoring system called CANET is now in practice in at least 10 universities. It doesn't come from Cochrane, because evidence-based medicine started at the time of Alexander the Great. His based philosopher Aristotle was teaching him logic, which is evidence-based science. Evidence-based, ladies and gentlemen, doesn't mean eminence-based. Eminence said, professor, dean, rector, ministry said, and this is the law. It is not. It must be, evidence-based data. This is the illustration of CANET test. We start with anteflexion of the head, cranial sutures, blinking, facial expression. Most of the parameters we have in CANET are from face. We also have isolated leg movement. Do we have competitor? Yes, ultra-fast magnetic resonance tell us a lot, but doesn't tell us enough about face. And no one would give 4 million euros for magnetic resonance to study fetal behavior if the most expensive 4D machine costs 100,000. There is another problem with magnetic resonance to be used in pregnancy. And if above 1.5 Tesla, it is not allowed in America. So I did not say magnetic resonance pregnancy is dangerous, but nobody proved that it is not. So we have to be careful with magnetic resonance. As Winston Churchill used to say, this is not the end. This is not even beginning of the end. This is the end of the beginning. So that means we will go further. We will go further, and further study will move to cerebral palsy, because early signs appear before 18 months of age, and parents are often the first to suspect that their infant is not developing motor skills. Normally, this is called developmental delay. Most of the knowledge 30 years ago we've got from 2D real time, and this particular Dutch group studied it for 30 years. No one test became routine. This very advanced lady physiologist, Di Pietro, said no unified assessment exists from America, but she read our paper in 2004 and said that levels of details are very promising. Neurological examination at birth. Of the 100 patients with proven diagnosis of cerebral palsy showed that neurologists, 47% of babies having cerebral palsy had normal neurological tests, showing what I believed from the beginning, that intrauterine neurological assessment is much more accurate than neonatal. Why? We are doctors to treat disease, not to change biology. And biology said that fetus in utero is astronaut. There is no tyranny of gravity. Fetus is floating, and fetus can be much easy neurologically evaluated. So new field is cognitive function of the fetal brain, study emotional and social behavior, but very, very complicated. You see thalamocortical architecture, where everything started, and fetal sensory system requires stimulation to develop. And what does stimulate is peripheral sensory system, maturation, and so on. Again, cognitive function. If you look at these two babies, we have videos showing their intrauterine development. They do have their own body language. They do communicate. They understand each other. Because one of them, the right one, lost the socket. And the brother tried to remind him that he is without socket. But that language, that discussion continues for centuries. Could we study this in utero? Yes, we do. And we are now deeply involved in this. You see, unfortunately, it doesn't move, a beautiful picture of two pair of twins. After quarantine, you know, they like each other and they are very friendly. Fetal awareness, we published first paper as early as 2005, and we studied fetal pain awareness. I will not go deeply. Fetal sensory system, as you can see, is developing through pregnancy, throughout the pregnancy. And we can start to study each part of this development. Bile acids in maternal blood in nasal chemoreception, in intrahepatic cholestasis produce specific answer from the face. And here you can see a lovely slide, one of the best I ever produced. You see urination of the female baby, and the urine comes into the amniotic fluid. How gustatory experience then developed, we can study from the face. Is the face showing us happiness or pleasure or feels pain? Answer will come soon. Visual development is very difficult to be studied, but it can be studied. Auditory sensory development as well, and many other parameters. And this is grasping umbilical cord, swallowing and eye blinking, and something is bothering, and that's what does bother this angry baby is umbilical cord. I just like to tell you that even phenotype expression, Panos was with us studying this, and we are well advanced in this field. And the origin of individuality can be studied on fetal face. This is even in monochorionic monoamniotic twins. You can see very strong kick of the brother to the face of its brother. Now, ladies and gentlemen, big question is, does kicked baby feels pleasure or pain? Can we study this? Yes, we can. How? Studying facial expression. Face is predictor of the brain. So, ladies and gentlemen, I am now at the last minute of my slide. I will show you what we do with temperament formation and what is the future. Many things, there are many questions, hardly many answers, and there is a need to improve and discover. Ladies and gentlemen, I have to pay credit to the group of brilliant people and good friends on the screen. You know all of them, I don't need to explain. All the accumulation of knowledge was contribution of each of you, big or less, smaller, but no one non-important. Thank you very much, members of the leading members of Donald School. Among them is, of course, Jihad. And we hope for the next brain meetings. Brain became most important fetal organ, very actual in science. Whatever you publish or submit for publication, journal will immediately accept. Thank you.
Thank you very much, Professor. Professor Kurjak, it's always a pleasure to listen to your lectures, and you again evoked our curiosity about the fetal brain and fetal neurology.